Hi guys, thanks for joining me again for the acne series. In the last video, we talked about how acne forms and how cleansing thoroughly is very important to preventing breakouts. If you missed that tutorial, don't forget to check it out in the tutorial section of the Soko Glam YouTube channel. Mr. RX, what's the next question for today? Okay, the next question is, what is the difference between blackheads, whiteheads, and cystic acne? There are many types of congestion and acne, so yes, it can be confusing. So let me illustrate it for you. Whiteheads occur when the blockage is near the skin surface and the blocked follicle pushes outward and forms a whitehead. Blackheads occur when oil is blocked at the top of the follicle, which then oxidizes, aka turns dark, due to contact with air. Cystic acne is when it develops deep into your skin, creating a red, tender bump. Hormones are a main cause of cystic acne, and sometimes they're difficult to treat with topical products because the inflammation is further away from the surface of your skin. The next question is, what's another way to prevent and treat acne? Chemical exfoliation is a perfect way to treat and prevent acne. Remember when I told you that acne forms due to a mixture of excess oil, bacteria, and dead skin cells? Well, your skin does shed dead skin cells every single day and produces oil every single day. So you're gonna have to figure out a way to maintain that. Physical scrubs do a great job at removing dead skin cells at the surface level, but when it comes to cleaning the inside of your pores, you're gonna need chemical exfoliants. AHAs, or alpha hydroxy acids, and BHAs, beta hydroxy acids, are chemical exfoliants that will help whisk away excess oil and clear away dead skin cells. They can actually do that deep within your pores. I recommend BHAs to target acne because they are oil-loving and have anti-inflammatory and antibacterial properties as well. After coming back from a Korea trip last year, I experienced a really bad case of hormonal breakouts along my chin and jawline. And it was recurring ever since then. So I've been pretty personally invested in finding a solution that will help me treat these breakouts. I've tested a bunch of products, and what I found that best helped me includes products that have chemical exfoliants in them. Here are the products that I use when I'm dealing with breakouts. First, I use a cleanser that contains a BHA such as salicylic acid. I personally love salicylic acid because it's oil-loving and anti-inflammatory. After cleansing, it's onto the toning step. This particular toner is great for acne-prone skin because it works hard to hydrate and prep the skin while chemical exfoliants keep your pores in check. If I'm dealing with a lot of breakouts, I use two types of serums. I apply the COSRX AHA 7 Whitehead Power Liquid in the areas I have whiteheads or breakouts. Then I use the COSRX BHA Power Liquid across my T-zone to reduce blackheads and pore size. I love how these power liquids are slightly thicker in consistency, so it glides and absorbs into my skin quickly. There is no added fragrance, just simple, amazing ingredients used to target acne. Keep in mind these are high concentrations of chemical exfoliants, so you may want to alternate the use of these serums. Lastly, I moisturize to coat and protect the skin with the COSRX Natural BHA Returning Emulsion. When I only have cystic breakouts on my chin and the rest of my skin isn't affected, I use my regular moisturizers on my cheeks and forehead. If you're heading out, remember to use sunscreen. Chemical exfoliants can sensitize the skin, which means you're more susceptible to pigmentation. With this routine, within a week, my cystic acne disappears and my pores are less visible. It's awesome. Now that you saw my routine, let's talk a little bit about some acne myths. True or false? If you have a pimple, you can pop it at home, just do it very carefully. False. Don't touch the pimple. Applying pressure to a pimple can actually cause bacteria underneath the surface of the skin to rupture and cause other pimples to form elsewhere. One way I avoid touching my breakouts is by using COSRX pimple patches. They are these thin, clear patches that stick to your skin and really help heal your breakouts by eliminating the bacteria and drying out the infection. These are little miracle workers. They have even helped heal my cystic acne. True or false? The more you exfoliate, the better. False. When it comes to physical and chemical exfoliation, you can overdo it. So when you use a physical exfoliant, such as a scrub or a cloth, apply gentle pressure. If you use a chemical exfoliant, make sure you don't use it every single day. So that's the end of part 2 of our acne series. If you want to learn more about the products, just click on the links below in the description box. And don't forget to check out our next video, which is gonna be all about acne scarring and lightening pigmentation. Just hit the subscribe button below and you won't miss it. Thank you, bye.